So today I'll be discussing to you informed consent. In our previous topics, I have repeatedly mentioned informed consent. Now we will give you the details of informed consent, or what is it now. So guys, when I say informed consent, your informed consent is needed in any of the procedures that are posted in your screen. One is admission in your healthcare agency, meaning if your patient will be admitted in the hospital, you need to have informed consent. Second, invasive procedures. So when I say invasive procedures, what do we mean by that, guys? How will I know that a procedure is invasive? In simple terms, how will I know that the procedure is invasive? Anybody?
Requires sterile techniques.
It requires sterile technique. Other than that, what else?
Include
May ginasulod sa body, sir.
Okay, it involves entry of something inside the body. So may that be a tube, may that be a blade, it involves entry of something inside the body. Or basically, it involves a cut in the skin, okay, or a cut through the skin. That's how you can classify a procedure to be invasive. Now look at that one. You have your IV central line insertion. Students, when I say central line insertion, it means central line. It means a major blood vessel of the body. A major blood vessel of the body is making use of that line. A major blood vessel of the body is making use of that line. Now let's differentiate it. When I talk about IV lines inserted here, if I inserted an IV line here, those IV lines, my dear students, are referred to as your peripheral intravenous lines. Okay? Ang commonly tinatawag natin sa clinical area na dextrose. So those are your central lines. Take note of that. Those are your central lines. Now, if I talk, those are your peripheral lines. Again, yung mga dextrose na ginagamit natin is your peripheral IV lines. When I talk about central lines, guys, these are lines that may be inserted at your brachial. When I say brachial, it's here. Okay, yan yung brachial natin. Pagkatapos, it goes towards the heart. That's why it's referred to as a central line, because it proceeds towards the heart. So it's considered to be a more invasive procedure. That's why it needs consent. Now, doon naman sa IV line, you might be thinking, sir, paano naman yung IV line? Kailangan ba ng consent or hindi? Kailangan din sa class ng consent, but the consent for the IV line, okay, the consent for the IV line is considered to be an implied consent. Again, the consent for the IV line is considered to be an implied consent. Okay? So pag sinabi nating implied consent, ibig sabihin, once the patient has entered the hospital and once the patient has signed the admission consent, given na nakasabay na doon ang pag-insert ng IV line. Okay? Given na nakasabay na doon ang pag-insert ng IV line. So it does not mean that every time that you will insert an IV, you will need to ask for the consent of your patient. No, that's not how it works. No. Pero kapag central line siya, take note, the central line will be made. No? It's an access made by your surgeon. So you need to have an informed consent every time there will be a central line insertion. Okay, kindly take note of that. Now, some treatment programs. No? Pag sinabi kong treatment programs, included dyan chemotherapy. Why? Why do you think, guys, chemotherapy? First of all, before I'd ask you to answer that question, ano muna yung chemotherapy? Chemotherapy is the management for what problem that we have?
Cancer.
Cancer. The management of cancer. No, it's actually used for the management of cancer. Good on that. Now, if I will ask you, why is it that chemotherapy would really need a consent? What do you think is the reason for that?
It involves radiation, sir.
Sige, yes, Jasmine muna. Jasmine, ano daw?
Because it involves radiation.
It involves radiation. What else?
kay invasive man siya sa procedure.
Okay, those are good answers. Okay, but allow me first to differentiate to you, ha. In cancer, there are two main management. No? One is radiation therapy, and then another one is chemotherapy. Okay, so to say it, so to differentiate the two, chemotherapy uses quote-unquote chemicals. Radiation therapy, quote-unquote, uses your radiation. Okay, bakit quote-unquote? Because it is your MS, so we'll be discussing that in details to you. Now, both of these procedures actually need consent. And the main reason for that is that it's because these two procedures entail high risk. These two procedures entail high risk. Okay, now look at this. If your patient is having chemotherapy, I don't know if you've known patients with cancer, what have you seen as a side effect of chemotherapy?
Pangluyas.
Okay, weakness, no? Weakness, that's one. What else have you seen?
Hair loss.
Hair loss.
Hair
Hair loss,
loss.
sir.
Okay, hair loss. In medical terms, your hair loss is referred to as alopecia. Okay, alopecia. So alopecia is something that is expected. What else? Ano pang mga nakita nyo dun sa cancer patients?
That suppress a lesser immune system.
Very good. There is actually a decrease of the immune system, decrease of immune response. And the term that you used was right, that is immunosuppression. Okay, so these are things that could possibly happen to a patient who is undergoing chemotherapy. And for that reason, guys, it really needs to have an informed consent. Okay, now picture, if you have been admitted in the hospital and then an antibiotic was given to you, were you asked to sign an informed consent? Sa mga na-admit sa hospital or kahit sa clinic, okay, when the doctor gave you an antibiotic, did they ask you to sign an informed consent? Meron or wala?
Wala, sir.
Wala, di ba? Okay? So guys, routine antibiotic therapy, wala. No? Halimbawa, punta ka sa clinic, sabihin, uy, miss, mayroon kang UTI. Sige, these are the antibiotics that you will be taking. Are you signing an informed consent there? No. Okay? Eh, sir, bakit ganon? Kasi class, that consent is considered to be implied consent. Halimbawa, you are in the hospital, they inserted an IV line. Will they ask for your informed consent na signed? Hindi, kasi implied consent din yun. By the time that they will give you medications, will they ask again for your signature? Hindi rin, kasi implied consent din yon. But by the time, for example, sabihin, uy, kailangan mong magpa-chemotherapy, there needs to be a formal signed consent. Kailanganin talaga ng formal signed consent. If you will be asked what's the reason for that, it's because that these procedures are high risk. It's because that these procedures are high risk. Okay? Ganon yung isipin nyo. Then, after that, the participation on research study. Okay? So you will know, if you have been respondents of the researches that are being done by our students in third year, level 3, level 4, you have noticed that you were asked to sign a consent or you were asked to indicate that you have agreed to the provisions of the research that they will have. So that's one thing. Those are the situations that need an informed consent. Excuse me. So, pag titingnan natin, now, these are the principles of your informed consent. Principles of informed consent would involve right of every individual. So, right and responsibility of every competent individual to advance his or her welfare. Okay, that's the main point, to advance his or her welfare. It is also the right and responsibility being exercised by freely and voluntarily giving consent, designating agreement or refusal. Look at those. The words agreement or refusal are highlighted, guys, to emphasize to you that every time we make an informed consent, it does not mean that the patient will always agree. There will be instances that the patient will not agree, and that is still referred to as your informed consent. That is still referred to as your informed consent. Now, that could include undergoing any procedures or treatment based on sufficient knowledge of the benefits, burdens, and risks involved. So look at the word, guys, sufficient knowledge. That's one also of the keywords that you need to remember. Next, these are the 4 requirements, guys, for consent. Okay, kindly memorize these 4 requirements for consent. So 1, decision-making capacity. That individual needs to have a decision-making capacity. Now, give me an example of an individual who does not have the invitation act, who does not have the decision-making capacity. Give me an example.
Unconscious patient, sir.
Patient na unconscious, that's one. What else?
Sir.
Infant.
Yung patients na may mental illness. What else?
Mga
Infant, sir.
Infants.
Babies, sir.
Okay, babies. Good. Those are examples of patients who could not yet decide for themselves. Okay? So hindi po natin pwedeng sabihin na informed consent siya if somebody who signed the consent is 16 years old. Because we know that what is the age of majority here in the Philippines? What is the age of majority here in the Philippines?
18
to
21.
So it should be 18 and above. So hindi pa po siya kayang magbigay ng decision-making capacity. Now, let's say for example that the patient who's 16 years old is about to be operated. Who will give the consent?
Mother.
Mother, sir, or father.
That would be the mother. That would be the mother. Kaya una po talaga sa listahan ng legal is mother. No? Legality is mother po talaga yung immediately responsible for the child. Now, documentation of consent. So when we say documentation of consent, this consent could be signed in chart. This consent should be documented also in the nurses. Then disclosure of information. As I have mentioned previously, when I talk about informed consent, what do we get? Are we getting only, are we informing them only of the benefits, or do we inform them of the benefits and the risk?
Benefits and the risk, sir.
So kasabay talaga ang benefits and risk. Okay? When you are talking to this patient, you need to inform them of the risk that they would have. Then after that, the comprehension of information. Okay, so when we say comprehension of information, what do you think is the best way for me to determine that my patient indeed comprehended what I talked about? Paano ko malalaman na naintindihan ni patient yung mga
There
sinabi ni
is
doctor?
a response, sir.
Okay, you get a response. What else? How about others? What's your idea?
Willing sa sir magpamate.
Willing to listen. What else?
Ma-explain.
Follow sa instruction, sir.
Okay, I think somebody mentioned that it will be explained, and then some mentioned that they will be able to follow the procedure. Very good. Okay, guys, for you to determine that your patient was able to comprehend it is that your patient should be able to explain it back to you. Okay, your patient will be able to explain it back to you in such a way that if your patient will say, "Nurse, parang hindi ko naintindihan ang sabi ni doc," the informed consent is not valid. Take note, 4 requirements of informed consent. In other words, even if nandyan yung tatlo pero hindi naintindihan ni patient, it's still considered to be invalid. Okay? Halimbawa, no, napirmahan na ni patient, na-explain na kay patient, tapos si patient 25 years old naman, kaya namang mag-decide, tapos about an hour before surgery, sabi ni patient, "Nurse, I don't know if what will the doctor be doing to me." Right away, okay, talk to the doctor so that the doctor could appraise the patient again. Again, it's the nurse who will talk first pala. Talk first, nurse. Pagkatapos, pag ayaw pa rin, kausapin ng doktor. Pag ayaw pa rin, document that the patient does not want it to go on. Okay, that's the requirement of your consent. Now, there are 3 conditions to be fulfilled. After makaya yung 3 requirements, dapat itong 3 conditions present din. Dapat 1, voluntary. Hindi pwedeng sinusuntok before mag-decide. Ikalawa, decision is made with an appropriate understanding of the circumstances. Dapat naiintindihan niya kung saan siya papunta. At pangatlo, the patient's choice is deliberate insofar as the patient has considered the benefit, burden, risk, and alternatives. As I mentioned earlier, dapat na-explore niya yung all aspects, no? All aspects of care. Now, patient with mental illness must also give consent. Take note of this, patient with mental illness must also give consent. Now, if I will be asking you legally, okay lang ba na yung value, sorry for using the term value, hindi dapat, okay lang ba that a patient with mental health problem will be the one to sign only the consent, or do I need also the signature of an immediate family member?
Need ang consent, sir, sa immediate family.
Okay, so I need still the signature of the, I still need the signature of the immediate family member. Okay, I still need the signature of the immediate family member. Okay, now you might be thinking, sir, bakit kailangan pa ng signature, no, ng immediate family member? Because nga, this patient has a mental health problem. This patient may not be able to decide for himself or herself properly. Okay? If that's the case, sir, bakit yung first sentence, it says, patients with mental illness must also give consent. Okay? Di ba? Sabi natin may mental illness siya, bakit pa natin kailangan or bakit natin kailangan kumuha ng consent niya? Guys, the purpose there is to increase the participation also of your patient. Okay? For example, if you're dealing with a patient who is suicidal, hindi naman pwedeng sabihin mo doon na pupunta ka lang sa room tapos right away inject. Bye ma'am, kasi suicidal ka naman, hindi ka naman makapagbigay ng consent. No, that's not how we treat our patients. Okay? Kung suicidal si pasyente, mas na kailangan na kausapin mo siya and then inform the patient, ma'am, hi, I'm your nurse for today. I will be giving this medication. This medication can actually give you in your mood. This medication can actually give you some strength. Okay? Depende kung anong gamot yung binibigay. Okay? Because guys, if you will be dealing with patients with mental health problems, tapos bigla nyo na lang siya halimbawa tinusok ng kung anong needle, baka mag-wild. There is a big tendency that these patients will go into one. Baka hindi mo makontrol yung passion. Okay? So one of the primary function of your informed consent is the protection of the right to self-determination. Now, right to self-determination. Give me one word for that. What is that? What principle of ethics is that?
Autonomy, sir.
Very good. That would be your autonomy. So right to self-determination, that would be your autonomy. Now, you have the term paternalism. When I say paternalism, guys, in our own context, here in our culture, what do I mean by paternalism? Do not look at the definition. Ano yung ibig sabihin ng paternalism? Guys, our culture is paternalistic. Yes, go ahead, Pau.
In authority, sir,
Sino yung in authority?
ang paternalism, father, sir.
Yes, yes. Thank you for that, Pau. No? So usually, in a paternalistic culture, it is the father with on authority. But since we're learning ethics, you need to understand that paternalism actually applies on both sexes, no? Male and female. Okay? Now, what do we mean by paternalism? Parang nagiging father ka, parang nagiging tatay ka, tulad ng role ng tatay natin in a traditional Filipino society. Okay, I'm saying traditional because the modern Filipino society naman sees father and mother as equal footing in the household, di ba? Now, go back tayo sa paternalism. So paternalism allows one person to make a decision for another and assist people to make decisions when they do not have sufficient data or expertise. Okay? Basahin nyo muna. Basahin nyo lang silently yung first paragraph na yan. Guys, the main message of that paragraph is this. Since my patient is not knowledgeable of medical terms, since my patient is not knowledgeable of the medical problems that are encountered, we act like a father to our patients. Okay? Now, this commonly happens among doctors, no? This commonly happens among doctors. So, anong nangyayari, guys, among doctors na? Yung ginagawa nila is this. For example, the patient will say, hey, doc, anong nilang ma-UTI? Okay? Di ba the doctor, for example, will ask, patient, what do you want to be done? These are the options. Di ba? Present sa kanya yung options. Tapos yung pasyente and family member would say, hey, doc, kung ano lang da maayo Okay? In Tagalog na kung baga, doc, kung ano lang yung mas nakakabuti, yun yung gagawin natin. Okay? Parang ganun. So, with that question, it implies how much we value paternalism in our healthcare. So paternalism actually exists when one healthcare worker intervenes to prevent patients from harming themselves in a serious way. So halimbawa, ikaw namang nurse, no? If you are in the hospital, tapos nakita mo halimbawa yung pasyente mo is trying to pull out the IV line. Okay? Trying to pull out the IV line. As a nurse, how would you intervene? Ang tendency mo is that you will stop your patient and then you will tell your patient, sir, do not do that. You're acting like a father because you're telling your patient, do not do that. It might harm you. Do not do that. You actually need the IV fluid. Okay? That is where the principle of paternalism inserts. No? So sometimes, baka isipin nyo, sir, parang contrary naman yan sa principle ng informed consent. No, they actually supplement one another. They actually supplement one another. Halimbawa, The common example in the hospital is that the patient will try to pull out the IV line. And then you will tell the patient, sir, do not do that. You need the medications. Sir, allow me to assist you. Please do not pull it out. You need that for your intravenous fluid access. Pagkatapos, halimbawa, you know that the patient is conscious at saka you know that the patient is in the right mind. You need to talk to the patient. Sir, these are the benefits of your IV tips. Okay? Sir, bakit niyo po siyang gustong tanggalin? Pagkatapos, kapag sabihin talaga ng patient na gusto niyang tanggalin, and you know that the patient is conscious and deciding properly, you can actually pull it out after informing the physician. Okay? You can pull it out after informing the physician. But take note kung makita nyo, ang una mong in-apply, paternalism muna. Because you are trying to guide the patient whose medical knowledge is very minimal. Now, next, there are two types of paternalism. One type is what we refer to as your weak paternalism, and then the other type is strong paternalism. When does the strong paternalism apply? The strong paternalism actually applies, okay, when you are with a competent person. Halimbawa, you know that this person is in the right state of mind, okay, right state of mind itong taong to. Pagkatapos, she tried to pull out something. She tried to pull out the IV fluid. So that's strong paternalism that you will apply. But if the patient is incompetent, halimbawa yung patient stroke, halimbawa yung patient impaired judgment, you can actually apply what you refer to as your weak or limited or restricted paternalism. So that's the difference of the two. Pag sinabi kong strong extended paternalism, competent pa yung tao. Pag sinabi kong weak paternalism, that means that the individual is already incompetent. Okay, take note of that. Now, there is a third term being referred to as proxy consent. Pag sinabi nating proxy, halimbawa sa kasal, di ba? Pag hindi ka maka-attend, sabihin, uy, proxy muna. Okay, so proxy is like a substitute. So when I say proxy consent, this means legally acceptable representative. So this is the process by which people with the legal right to consent to medical treatment for themselves or for a minor delegate that right to another person. The key word there that you need to look into is delegate the right to another person. In other words, halimbawa ako, no? Okay, halimbawa ako, I don't want to decide for my medical care. I would say that I delegate this to my mother. I would like to delegate this to my girlfriend. Okay? Kahit sino po yung de-delegatean, legally siya po yung mas responsible and mas accountable on the care that you have. Okay? So for example, if I delegated my care to my girlfriend, who will have the legal say on what to do to me? Is it my mother or my girlfriend?
Girlfriend, sir.
Okay, girlfriend, Kahit sabihin pa ng mother, girlfriend ka lang, ako nanay, wala po siyang magagawa. Okay? So kaya kayo, be careful kung sino yung ina-appoint nyo na legal proxy. Baka di pa boyfriend, girlfriend kayo, tapos next year break naman. Okay, kidding aside. Now, these are the three fundamental constraints for delegation. Why they are said as constraints? Because these people could not delegate. Halimbawa, so the person must have the right consent. In other words, hindi pwede na ikaw yung mag-delegate kung ako mismo, halimbawa, halimbawa, I'm mentally incapacitated. I could not delegate it to my girlfriend unless I did it before my mental incapacitation. Okay? Or halimbawa, if somebody is a prisoner, that prisoner might have some rights absolved or some rights may not be applicable to him. So for that reason, halimbawa yung prisoner sasabihin, no, I allow blah, blah, blah to take care of me. Hindi pwede. Okay? Because wala siyang right to delegate as of this time. Next, the person must be legally and medically competent to delegate the right to consent. As I have mentioned, hindi siya pwede na mag-delegate ka by the time that you are mentally incapacitated. Okay? And then dapat it should be delegated to somebody who is legally and medically competent also. So hindi pwede na sabihin ko, oy, doon ako magde-delegate to somebody who is mentally incapacitated. Dapat, somebody who will be my proxy is also ready to make this. Okay? It will be ready to make the decision. Now, there are actually two types of proxy. One, the durable power of attorney or healthcare proxy. And then another one is your living will. Okay, one is the durable power of attorney or healthcare proxy. Another one is living will. Ano po ang ibig sabihin ng power of attorney? Guys, it is not the attorney who will decide, ha? Unless you appointed your attorney to decide in your behalf. Again, guys, ha, it is not the attorney who will decide unless you appointed the attorney on your behalf. Now, what's the purpose of that? So, attorney, the power of attorney would delegate the right of consent to a specific person if they are rendered temporarily incompetent by the medical care. Halimbawa, if patient A, for example, appointed somebody to be a healthcare proxy, by the time class that he will be mentally incapacitated, it will be the healthcare proxy who will decide for him. In other words, you are authorizing somebody to decide. Not authorizing somebody to decide. What's the difference when it comes to your living will? When I say, guys, living will, it is a written, legal document prepared by a competent adult. Okay? Spells out the medical treatment. So kung titingnan nyo, living will, halimbawa, now for example, I will write right now, I, Albert John Porque, by the time that I will be mentally incapacitated, does not want to have the following. I only want to have the following. Okay? It spells out, what do you want? Do you want to have NGT? Do you want to have basic life support? Do you want CPR? Do you want to be resuscitated? Do you want them to intubate you? Okay? You can indicate those in your living will. Okay? So class, anong ginagawa sa living will? Usually, no, kapag may kakilala kang abogado, pwede na ipanotarize yan. Ita-type ng abogado, tapos ipanotarize. Now, what's the purpose of notarization? To make the record available to public access in such a way that by the time will come that you are medically incapacitated, that record could be seen in public. Now, another thing is that pwede din namang isulat, no? And then make sure na dala-dala mo lang if ever pupunta ka ng hospital. Okay? So, if you don't want advanced life support measures, that could be indicated in your living will. Okay? Plus, pag written will siya, as far as I'm concerned, dapat klaro that the handwriting is yours. Tapos, it should be signed by it should be signed and dated by yours truly. Dapat mapirmahan mo sa at ma-indicate ang date. Bakit important yung date? Halimbawa, class, kahit yung document 1995 pa, basta what's important is that they can prove that by 1995, you are in the right state of mind. Okay? Pero guys, for example, the document was dated 2020 and they know that in 2020, you might not be in the right state of mind. So, hindi po pwede. Okay? So, tingnan po, ganun po yung isipin natin sa living. Okay? So students, that will be your discussion for today. The next topic will be discussed later on.